In this video, we're talking about Uniderm Moisturizer Lotion. This lotion is used to treat or prevent dry, rough, scaly, itchy skin and minor skin irritations such as diaper rash and skin burns from radiation therapy. The active ingredients in this lotion work to soften and moisturize the skin, decrease itching and flaking, and protect the skin against irritation, such as from wetness. Dry skin is caused by a loss of water in the upper layer of the skin, and emollients/moisturizers like Uniderm work by forming an oily layer on the top of the skin that traps water in the skin. This lotion contains common emollients such as petrolatum, lanolin, mineral oil, and dimethicone, as well as humectants like glycerin, lecithin, and propylene glycol, which draw water into the outer layer of skin. Additionally, it also has ingredients that soften the top layer of skin cells and help the dead skin cells fall off, keeping the skin in more water and leaving it feeling smoother and softer. For best results, apply this lotion daily as needed to the affected areas. It's best to apply it after bathing or showering, when the skin is still damp, to lock in the moisture. Make sure to use the Uniderm Moisturizer Lotion as directed on the package. Some products may need to be shaken before use, so be sure to check the label. Apply the lotion to the affected areas of the skin as needed or as directed by your doctor. The frequency of application will depend on the product and your skin condition. If you are using it for dry hands, you may need to apply it every time you wash your hands throughout the day. For diaper rash, clean the area well before applying the lotion. And if using it for radiation skin burns, check with radiation personnel before applying. Only apply the lotion to the skin and avoid sensitive areas like the eyes, mouth, nose, and vaginal/groin area, unless directed otherwise. Be sure to follow all the directions on the label, and consult your doctor or pharmacist for more details. To get the most benefit, use the lotion regularly. It's best to apply the lotion after bathing or showering while the skin is still damp. For very dry skin, your doctor may instruct you to soak the area before using the product. And remember, long, hot, or frequent bathing can worsen dry skin. If your condition persists or worsens, or if you think you may have a serious medical problem, seek medical help immediately. When using Uniderm Moisturizer Lotion, it is important to be aware of potential side effects. While most people can use this lotion without any issues, some may experience burning, stinging, redness, or irritation. If these effects persist or worsen, it is important to consult with a doctor or pharmacist. If your doctor has prescribed this lotion, they have determined that the benefits outweigh the potential risks. Serious side effects are rare, but it is important to seek medical attention if you notice any unusual changes in your skin or signs of a skin infection. Additionally, if you experience symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. It is important to note that this is not a complete list of possible side effects, and if you notice any other effects, it is important to contact your doctor or pharmacist for guidance. If you are in the US, you can report side effects to the FDA, and in Canada, you can report them to Health Canada. Before using Uniderm Moisturizer Lotion, make sure to check if you are allergic to any of the ingredients in the product. This is important as some ingredients may cause allergic reactions or other problems. If you have any skin cuts, infections, or sores, be sure to consult your doctor or pharmacist before using this product. Some ingredients in the lotion, such as preservatives and fragrance, can make your skin more sensitive to the sun. Be sure to check the label for any warnings and ask your doctor or pharmacist if you need to take any special precautions when in the sun. Your doctor or pharmacist may advise you to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and protective clothing when outdoors. If you get sunburned or have skin blisters/redness, be sure to tell your doctor right away. For those with acne-prone skin, look for the word non-comedogenic on the label, as some products may worsen acne. Additionally, some products may stain or discolor clothing, so it's best to ask your doctor or pharmacist for more details. If you are planning to have surgery, be sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, consult your doctor before using this product. It is not known if this product passes into breast milk, so it's important to seek medical advice before breastfeeding, especially if you are applying this product to the breast area. When using Uniderm Moisturizer Lotion, it's important to be aware of potential drug interactions that could affect how your medications work and increase your risk for serious side effects. To help prevent any negative interactions, keep a list of all the products you use, including prescription and non-prescription drugs, as well as any herbal products, and share this list with your doctor and pharmacist. Remember to always consult with your doctor before starting, stopping, or changing the dosage of any medicines. This will help ensure the safe and effective use of Uniderm Moisturizer Lotion. If this lotion is swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms like passing out or difficulty breathing, it is important to call for emergency medical assistance. Otherwise, contact a poison control center immediately. In the U.S., the local poison control center can be reached at 1-800-222-1222. For Canadian residents, they can call their provincial poison control center for assistance. To prevent dry skin, it's important to use lukewarm water when bathing, take baths or showers less often, keep baths or showers short, and use a humidifier when the air is very dry. There are various types of emollient products available, including oils, creams, lotions, or sprays. Some may contain fragrance or other ingredients that some people may be sensitive to. It's best to consult with your doctor or pharmacist to find the product that may be most suitable for your needs. If you forget to use Uniderm Moisturizer Lotion on your regular schedule, just use it as soon as you remember. But do not use extra or use it more frequently than directed to make up for the missed dose. Make sure to check the storage information printed on the package and ask your pharmacist if you have any questions. Keep the lotion away from children and pets. Avoid storing the lotion near high heat or open flames, and do not puncture or burn the container. Do not flush the lotion down the toilet or pour it into a drain unless instructed. Properly discard the product and it is expired or no longer needed. Consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.